Welcome to our MOTS client entry webinar of December 2nd. It's the first Wednesday of the last month of the year 2020, and it's been quite an interesting year. And I've been told that it's a Chinese blessing, but it's not really meant as a blessing. It's more like if you have an interesting year, it's usually not a good thing. I see a question popped up. Does that mean there's something not right? I'm not hearing you. Oh, there you are. Yes, sorry, Nicole. Welcome, everyone. I hope you can hear everything properly, you can see everything properly. And for those of you new, it is a muted presentation that we do, and we have several different speakers, and all the speakers will be introduced to you in a little bit. With me are my co-workers, Lyle Ming, Justin King, Jody Kramer, and Mary Hurley is not yet there yet, but hopefully she will join us soon. If you have any questions or if something is not clear, there's a little menu panel that popped up when you joined that has a box where you can type in your questions. And while one person is speaking, the other members of the team usually monitor that little chat box or the question box and see what's going on and if they can help you. And sometimes they think, well, maybe that's an interesting question that everybody should hear or that we want to share with everybody, then we'll bring it into the meeting. So. It is recorded for those of you who wonder about that. We always record it. I apologize for last month if you were attending and you were not able to complete the session. We tried to put it on our website, but somehow it got corrupted during the recording, and we were not able to get it into the right format for us to put it on our website. So unfortunately, we have to. November 1 currently is not in the list, but hopefully this one will work. So for those of you who say, well, this is probably a good idea for my coworkers to watch because it's several items on the agenda that we talk about off and on in business meetings or staff meetings or stuff like that. So that's why we will put it on our website, and it usually goes within a couple of days if there's no hiccups. Well, for you who are wondering, why do we do these webinars? Well, of course, to give you information, because it is a live system that we have, and currently there's not that many changes or enhancements because everything is kind of in a holding pattern for a lot of reasons. Financially is one of them, of course, and but we are working on changes. And when there are changes or updates or enhancements or rules that change, we will definitely let you know through this webinar. This is one of the tools that we use, and we also have a messenger, and sometimes we just send out other emails as well. So data issues, if there are any data issues, and there are usually some, we like to discuss these in the webinars. We like to use these webinars to get your feedback, to get information from you guys to see what's working and what's not, or how we can improve things. Future webinar topics, also very good one. Sometimes we say, hey, if you have an item that has been gotten your attention and you'd like to hear more about it, let us know. We'll put it on the agenda and we'll talk about it during the next webinar. So, and again, as I mentioned earlier, if you have any questions or any questions that you had been having for a while and you're not really sure, just let us know and hopefully we can answer them today. Okay, I'd like to start with, go back to the agenda and say, okay, we are going to talk about Lyle's going to talk about the state of affairs. I'm going to talk about an inactive status. Justin will have some information on submission stats. I will talk a little more about Aid and Assist, a specific program, training during COVID times, and Jody, our specialist for EDI, will be talking about what to do and how to do when you start thinking about switching from client entry to electronic data interchange. So I see still a little question mark. Does that mean a question from someone? The website link. Yes, we will do that. Okay, Lyle, please go ahead. Current state of affairs.
Good morning, everyone. So currently, the whole MOTS team is working from home. We have state-issued cell phones, and we can reach out to you via these phones when necessary. Email MOTS support with any issues. We'll try to get back to you as quickly as possible. We're currently under guidance not to approach providers, and this means we're not going to be like, we expect you all to submit your data, and if you're not, we'll be reaching out to you at a later time. And if you need us, we're here for you, but we're trying not to do less outreach because we know a lot of providers are really overwhelmed during this time. All in-person trainings have been canceled, and if you need a training or have a training request, me and Pete are more than happy to do a ad hoc webinar with you and go through our whole training process with you. So just be patient with us. And we wanted you to know that this year and lately we've had a number of phishing attempts. Currently the MOTS support box has been used last to try to phish someone, and we want to let you know that we'll never ask for any billing information from you or any financial information. And if you get any of these emails and it looks just fishy and like it's not from us, go ahead and send it to MOTS support and we'll investigate and we'll send it to our OIS team that deals with these fraudulent emails.
Excellent. Thank you, Lal. Yeah, it might look like it is an email from one of us, but when you mouse over it, and that's usually the way you need to work these emails, mouse over it and you'll see that the actual addressee is something completely different. So be careful with those. If it has something on about giving information or money or paying bills or invoices or stuff like that, just report it to your organization, see if there's anybody in charge of security, cybersecurity and stuff like that. So, they're trying to talk to me on a different thing, but I'm not there. So sorry about that. Go back to inactive status. Okay, two of the inactive statuses are left against professional advice, including dropout, or service discontinued by facility. And they kind of go together, but that also works for inactive status in general, because left against professional advice is and we have multiple. We also have completed, treatment completed, and there's a couple of other ones. But recently we had some questions about the difference, and one of the main difference is that left against professional advice, including dropout, is not necessarily going against professional advice, because if they just go absent without leave and they never come back and they're supposed to be there next week, you do not advise them not to come. So they don't really go against your professional advice, but they just never showed up. They, for who knows what kind of reasons, you try to contact them and they just, all you can do is leave a message on the phone, or you send an email that's not responded, or who knows what kind of reasons there are, but those things happen, and that is actually when they left against professional advice, and that is different. And then you kind of enter the treatment episode. You enter the information to close out the episode. So basically, you say, okay, we're done by the individual, but that's not really discontinuing the services, because discontinuing the services is meant for when an individual is not playing by the rules, when they're non-compliant with the treatment, or they're violating the UA rules, or the timeliness, or any of the rules, laws, policies, or procedures that you might have within your organization. They're kind of similar, but they are also a little bit different. And that's one of the questions that we recently had was, shouldn't they be the other way around? For some people asked that. So we try to explain it as best as we can in our manual, and it has it spelled out the way it's written here to if they not complete treatment with or without specific advice. So I don't think we ever advise them when they complete treatment, great, but to advise them to stop having treatment here, sometimes you might refer them to a different program because your program might not be working, but to just never show up or discontinuing is a little different. So that's what that's why we thought we'd bring it up in the agenda today. And there was a question about that. And is that The audio is choppy. I'm sorry. I hope it improves. Maybe because one of the other tools popped back in and it slowed it down. So let me go back and I'll see if I can do something about it. Okay, Justin, stats on submissions. Go ahead. And I'm not hearing anything, Justin. Is that just me?
No, I don't hear him neither, Pete. This is Jody.
Thanks, Jody. Justin, you're not one of the or your microphone is currently not working. And I knew you had.
How about now?
Yeah. Yes, you're back.
All right, I'll try that again. Sorry about that.
That's okay. It works.
So, as you all know, one of the MOTS reporting requirements is that every client record should be updated at least every 90 days. More frequently is preferred and often makes things easier for us and for you as the providers, but we understand that not everybody can do that. So 90 days is the minimum. We track that using this performance report. So in the pie chart on your screen, green indicates clients who were updated within the 90-day requirement. Yellow indicates clients aged within 3 to 6 months. Orange is clients who are updated within 6 to 12 months. And red is clients who have not been updated in over a year. Statewide, about 43% are in the green, which is pretty good, but that 31% in the red shows plenty of room for improvement. And on the next slide, we can see these two charts. There's a difference between data submission methods. Again, these are statewide numbers. The left shows stats for EDI submissions, and the right shows stats for manual submissions through client entry. EDI is doing a bit better, with nearly half in the green, but still over 25% in the red. Now, this is where somebody usually asks, what about clients whose information hasn't changed in the last 90 days? Are we just supposed to make up a change and enter that? There's a very easy solution to this problem. MOTS sees any behavioral health submission as an update. The whole idea is that we want to see how the client situation has or has not changed during the course of his or her episode of care, rather than just getting a snapshot at the beginning and again at the end. So if the client has gotten a job, married or divorced, reduced or increased substance abuse or use, please update the client's records to show those changes. If nothing has changed, you can open the client's behavioral health record and click the Submit button without making any changes. MOTS will still pick that up as an update, reset the 90-day timer for that client, and help keep your update rate in the green.
Excellent, Justin. It was a little choppy, but I think the visuals kind of helped and showed what you were talking about. So, and as you guys can see,
sorry about that.
No, those things happen these days. That's one of the things we have to deal with, and either we hopefully we can go back within a couple of months, or there are some organizational changes, and they have a standard setup for everybody at home to improve these qualities. And until then, we'll probably be struggling a bit here and there, and then we have good days and bad days. Thank you, Justin. And we go back to the agenda, and I'm going to talk a little bit about Aid and Assist. For those of you not familiar with Aid and Assist, it is a special program for people with mental illness who are accused of a crime. But the question is, those programs, so there are certain providers, it's usually counties, CMHPs, that coordinate for care for Aid and Assist. They don't really put them in treatment. They just get the information, they get some court information and other stuff, and they look for the program that they want to assist, and that should be taking the, the individual in treatment. But one of the problems that one of the questions that they asked us is the client is not in treatment, but we still do some work for it. So how do we set that up in our administration? So for those individuals who are not in treatment, an assessment-only record is appropriate. And an assessment only states it in a way that you think, well, they have to be done with a full assessment. Excuse me. But that's not necessarily the way it should go. An assessment only can also be just an aid and assist setup and a referral to a different program. You just the client comes in, you get an idea of what they're looking for, and you know that, well, we are a treatment program, but maybe this is not the right program for the individual. And it doesn't have to be a full assessment. It can be just based on the first intake, the first interview, that the individual probably needs more than just the program that you can offer. And then you can refer them to something else. For those individuals, and for those individuals that you set up for aid and assist, you just enter an assessment only record where you have the basic information, the first name, last name, date of birth, client ID, stuff like that, race, ethnicity. That's about it. It's the client profile. It's the first screen, the first tab that you have within the system. And that's all we need. And then you submit that, and then you're good to go. So that's one of the questions we had recently. And there were some discussions going back and forth, like, should we enter them, but we don't have all the information and they don't stay. So we have a very short treatment episode time, very short length of stay, because they're not really in treatment. We deal with them for a couple of days before they're actually in that program. And as soon as they enter that particular program that they've been referred to, or that they get their care that they're looking for, or that they need, then that program will do the full assessment and will get all the information and will start the admission and keep us updated on the progress of the program and how the individual is doing. So we thought we'd bring it up. It's been in one of the messengers a little while ago, and since it's been a question that comes up once in a rare while and hasn't been asked for a while, we thought we'd bring it to everybody's attention in case you were wondering, like, how was that working again? So, and if you still have questions, you can always send us an email, check our reference manual that we have online. So, there is another question, and I'm not hearing anything. Is it me? That must be me. Not sure who me is, but yes, everybody, I think most of us are doing fine. So, okay, sorry about that. And then, oh, yes, training during COVID times. Lyle mentioned it earlier in his segment that since the COVID-19 outbreak early this spring, we have not been able to do any in-person, in-classroom MOTS training. It was advised, although they're very small groups, but the in-classroom training of any kind in Oregon has been canceled, so we're not doing them either. And normally you'd see them on our website, and we have all the different dates, and you can sign up and let us know. That's not going to happen, and we have no idea when they are going to start up again. What we do have is a great series of videos on our website, and each video is 5 to 10 minutes about a certain segment of the MOTS client entry tool. We have a little one that starts with an over, like what are all the different pieces and which pieces should you need or should you look into, and then it does the client segment, and then the behavioral health segment, and then the addiction segment. And for those of you who do crisis or who do involuntary services, those segments are there separately, but if you don't do, it's not part of your program, then you can ignore those and you can just do the non-Medicaid services. And if you don't do any non-Medicaid services because all your services are Medicaid services, then you can also ignore that one. Although it never hurts to check those out, because maybe there's a little gray area of certain services that get declined, or services that get denied by Medicaid, and you're not really sure what to do with it. And maybe they qualify to be entered in the non-Medicaid services in MOTS. So you might want to check that out. So also, Lyle mentioned there's an option of a go-to. It's currently what we're doing is a go-to webinar, but we also have a similar subset of this tool is a go-to meeting. and then you can set up a training with an individual. All you need is 2 people and 2 computers and the internet, and you connect to each other, and one person can show the other person what they're talking about, what their questions are, what their issues might be. Similar as I'm presenting you now, I can show, or Lyle, we can show you the system, we can walk you through, what I usually do is do basically a demo, and if anybody has questions, then they can ask them right there and right away. Um, in contrary to the webinar, with a GoToMeeting, usually all the communication lines are open. The reason we kind of block them on a webinar default is because if there's too many lines open, there's too many background noises, and it can be very confusing. And as you've already established, there are challenges to get proper quality of the audio that we already have without too much interference. So, like I said, Lyle or myself, we set up a one-on-one with you, or 2 or 3 people if you want to get together within an organization because you have some new people, or you would like to do a refresher because you're not really sure on certain pieces and you've been doing them for a while, or you were introduced to the system by a coworker and you never had the proper training, you were just told to do it in a certain way, and sometimes it doesn't always fit because maybe it wasn't the right way to do it. Just let us know, send your questions, request to MOTS support, and there's always somebody watching there, and somebody will contact you and see what will be a good date and time. Usually I schedule an hour and a half, and most of the times it takes about an hour. Depending on the questions and depends on the size of the group. It's 1 or 2 people. We can usually do it in an hour. If it's a larger group, sometimes it maximum an hour and a half. So also, when you look at our website, not just the online training, but the regular training site, it also shows a table with all the in-person training and the webinars. That's currently almost empty because today is the last one of this year. So that will be filled soon. For those of you who were wondering and already took a look, I have the majority of them scheduled. There's 1 or 2 that we need to add, and then we can set up the schedule for next year for our webinars. And it's going to be simple. It's going to be the first Wednesday of the month from 9 to 10. So that's we thought that'd be easy for everybody to remember. And those will keep going on and continuing definitely through next year. So that might change in the future, but who knows? Okay, and then I'm going back and I'm handing over the microphone to Jody, switching from client entry to EDI. Go ahead, Jody.
All right, thanks, Pete. So yes, for those of you, we know even with COVID going on in these unprecedented times, many organizations are still looking into updating their electronic health records to a new one, or potentially just taking what they currently have and using EDI and developing that or putting that into use. So what we want to do is just go over some of the important pieces of that. If you're going to be considering that, things that we want to make sure that you take into consideration. So the first thing, if you're even considering it, just let us know. Sometimes depending on how you're set up in client entry, may impact how you're going to move to EDI, or maybe some of the resources that our teams need to have. So we just want to make sure we've got you on the horizon, on the calendars. We have resources dedicated for you when the time comes. The second thing is the electronic health records on MOTS functionality. Now, what that means is there's a lot of different EHR systems, and there's a lot of different methods that each of them use to capture data within the EHR system, and the way that they actually compile that data and get it sent electronically to MOTS. So sometimes when we think of going from client entry to EDI, an electronic method would be a lot more hands-off, not as much staff intervention, which is true, but there still is some tasks and things that need to be done depending on the workflow of the EHR's MOTS functionality. when you're looking at systems, maybe ask for a specific demo. Just have them see if they could walk you through like really what it takes from a client coming in, where the data goes, how do you create it for MOTS, how does it get to MOTS, how do you fix errors, those kind of things. That'll help you to understand what your business flow will be moving forward, and you can make sure that you have the appropriate amount of staff resources in line, and also just that your expectations are met with the project. It just seems to help. So there's no one way that's better than another, or one that's right or wrong. They all just have a different process and workflow, and which is fine. So anyways, moving on, number 3, we want to talk about project timing. And of course, that kind of goes along with letting us know. If you let us know, then we can talk with your project timing, things of that nature. Sometimes we have organizations that let us know even 12 months in advance. Sometimes we get calls where they're on a quick timeline and we're only 2 months from them changing, but sooner the better, so that we can try and meet all those expectations and tasks of our team to help your process go smooth. There is a way that we go from switching from client entry, putting data in that way, to EDI. So we talk about those and how that process will work, maybe some decisions that we want to make one way or another that fits best for your organization. The 5th thing is we set up a secure file transfer protocol. A lot of words there, but it's sometimes you might hear SFTP. And basically what this is, it's a location on our equipment and servers here at the state of Oregon for MOTS that is where your EDI files or your data actually gets put into. So it's kind of like a mailbox on our system for you, where your files get dropped off, and then where you pick up information from that submission to see how it went. So we set that up early, even if you're out 12 months, let's say. It's really helpful just to get that paperwork going, get it done up on our side, and then when you're ready to go, it's sitting there waiting. We do a couple refreshes, and it just makes things smoother. Number 6, we'll talk about client ID considerations. And what a consideration is that sometimes you may need to have the client IDs that you were using in the client entry updated to the new ones that may be assigned by your new EHR or your existing EHR. So that's something our team helps with. Some of you may be familiar with the MOTS data corrections request form, where you request different changes that our MOTS support team are the ones that do. It's similar to that. We go through a process to make sure we know all the IDs, and then our teams will work to get those changed. Again, 7 kind of ties back with number 2. Once you know how that MOTS process works, you can define the business flow and who's going to do what. It just helps your team as you kick off and get going. Number 8, you are going to test the files through EDI. We call this certification. So some of you may be looking at a system that has maybe already, a great number of providers that are sending data to MOTS through EDI. And we certify at the provider level, so at your actual files, even if that EHR system is already submitting with other providers. The reason is there's a lot of flexibility, different forms, uniquenesses that you can set up, which is great for flexibility and meeting the needs of your business and your clients. So we just want to make sure that however you've set yours up, that as it comes into the MOTS and is checked, that everything's in alignment. So it's just a good way we do it, make sure everything doesn't have any hiccups once we go live. Go live, obviously, is once we've got everything settled, we've got all the client IDs, we got everything taken care of, the files have been good. You start submitting with your new system or your existing system that's now able to send to us electronically. And then we do some follow-ups. So follow-ups can be possibly, maybe a follow-up meeting or a quick go-to meeting once a week, every couple of weeks, kind of whatever your organization deems is most appropriate for you. But this is kind of nice once you're live. If you've got questions on like, how is this or what is that? It just helps to get kind of the folks that are doing that familiar, gives us a quick check-in, and then we can extend those, or we can set a time limit on how long those would be reoccurring. So it's really very flexible. It's just a tool to help you and your organization and make sure things are flowing smoothly and that you have a good contact person and team here that we know that we're reaching out and touching base with you. So with that, I'm happy. I do most EDI stuff for MOTS, and Pete, of course, is my amazing backup and help. So if any of you are thinking about it, seriously, Pete's great. So if any of you are thinking about it, number one, let us know. We're here to help, especially with COVID. If you are, things are changing. We just want to make sure we get everything lined up and ready to go for you. We've got a lot of experience doing this now since we've been doing MOTS for quite a while. And so got a lot of lessons learned, and we're here to help. So again, thank you for your time today, and we look forward to working with any of you that do choose to change. Thanks.
Thank you, Jody. Yes, and also another thing that I've heard Jody do is set up connections between the different organizations, because when you are thinking of an EHR, there's a pretty good chance that it's already in use by some of the other organizations in Oregon. And you might want to hear from them. And it might be an organization that has a similar types of program as you do. So I know that you guys talk on a regular basis, or there's quarterly area meetings with managers, and maybe that's one of the things that you might want to ask them to talk about, that they compare notes, like, hey, what is working for you and what do you like? And because certain types of programs might be more leaning to a particular EHR. So there's, as Jody mentioned, there's no right one or wrong one or great one or horrible one. They all have their good things and other things that might need a little extra effort on the organization part, or changing in the setup that you might already have. So.
Yeah, Pete,
Yay.
I'm really thank you for bringing that up, because you're absolutely right. I know sometimes we've had organizations that have received, they're looking at different systems, and our provider group of folks are so great to collaborate and to help. So yeah, we definitely, like Pete said, we can help connect some dots, and so you can ask some questions and just get some perspectives and ideas. So yeah, thanks for bringing that up, Pete. That's something we might want to, or I might want to put on my notes to incorporate on future webinars. So thank you.
You're welcome. Thank you, Jody. I saw a question pop up, and let me go back to our agenda, and it is time for questions and answers, Q&A. So let me see what that question is. And the question is, I'm not hearing. Oh, that's still a problem? I'm sorry. No.
Oh, that's an old question. We've got a question about MOTS being redesigned and looking for a status on that.
Do you want to take that, Pete, or you want me to?
Go for it.
Okay. So yes, many of you have probably received information that MOTS is on the horizon to look at being replaced. So at this point, what our teams are doing is we are working with our stakeholders, which include EHR systems, as well as the providers, as well as our management and our program staff and things like that. The goal for the MOTS potential replacement is to help reduce the administrative burden on some of the additional reporting you do that is on top of MOTS, that may be going in quarterly spreadsheets or different things like that. So MOTS will be potentially replaced and redesigned. But I like, and maybe you can add to this too, I know from the EHR organizations that we've been working with, there's a lot of concern that if we do change that, how much is going to need to be, retooled, how much is going to have to change. And so there will be a few things, that may change on the back end or some of the development design. But Pete mentioned it good, and he can probably add to this, is that MOTS isn't really going away. So you're still going to need to be reporting to MOTS during all this time. The time frames I think we're looking at is, maybe I'm thinking that with the way we have next steps on our horizon, we've got 2021 that we're looking at getting some proposals and different things back to us. So when we're really talking about implementation and rollout, we could be into 2022, somewhere in that, but we will definitely, as MOTS rolled out in the beginning, there will be a lot of interaction, user manuals, documentation, all of that, training, a very cohesive transition. So definitely, you still need to keep reporting to MOTS, and if you're thinking of changing to EHR systems, the way their MOTS is working today is going to continue to be that until we do have something identified. Pete, do you want to speak to the, you explained it really well about the fact that certain elements still need to be captured and required, that we report on. So like those aren't going away.
Sure.
Remember when you said that? Okay. Yeah.
Yes, and I also like to mention that our good friend Biff let us know that we are in the RFP process for the campus replacement system. One of the things that we are looking at is to try to cut back on any administrative burden. The word burden already tells you that it's something you should not have, but any organization should have an administration, and that administration should be effective and helpful for an organization and to transfer information to between the different organizations. So one of the things we're trying, we know that there are several different ways of reporting outside of the MOTS system. So one of the things that we're looking at, and we are sending out a quarterly newsletter, and if you're not getting it, then you might want to ask around within your organization, because we try to send it to everybody who is in any way or form related to the MOTS system. If you're an agency contact, or if you do data entry, if you have a P number, anybody that has a number in the system, or if you're just a facility contact, there are different options of individuals to be connected to the MOTS system. So yes, there are certain things that will never go away. So things might change, things might be added, policy and programs change, requirements change, but a lot of the federal requirements that we have, and we, as the state of Oregon, rely on federal money as well. There's one of the bigger financial money streams is the block grant. In order to receive that block grant, we have to report to the federal government, and that is a lot of times it is basically the client basics, demographics and diagnosis, admission date, discharge date, how are they doing, some addiction information, a lot of the basics that we have been asking for as long as I can remember. And I've been here a while, so, and those things will not go away. So unless something amazing happens, but I highly doubt that. Even if there are big changes, the basics will probably still always be there, because those are the foundations of a lot of the programs. That you have to have some basic information. You have to start somewhere in order to know where you're going and to see if you can have any outcomes, if there's anything working in part of the program. So you got to have some start and see how that changes over time. So that's why, as Jody mentioned, it'll not go away. It might change. The look and feel of everything might change, because for those of you who remember the old CPMS system with all the different forms that we used to have, we're completely doing it differently now. So we might go back to that a little bit, maybe. We might go back to an admit and a discharge and an update in between, or some different setup. But the basics are definitely going to be the same. And if you want any information, as you can see at the bottom of this page, www.oregon.gov/OHA/AMH/MOTS, that's where all our information is. There are also the links to our monthly messengers where we give you information. That's where you can find the links to the online training videos, and you can get the information about the webinars that will be set up for next year. So. Okay, and if there's anything else. Oh, I have a question from Terrence about if somebody is leaving and they're the only person doing the administration. We know there's not every organization has a large EHR or has several different people or has enough room and flexibility and financial options to have a backup for certain tasks within an organization. If that happens to be the case and you're aware of that person getting a promotion or leaving or doing something that might get the reporting in jeopardy, just contact us, contact mots.support, and we'll contact you and we'll set you up with a user ID or whoever the person is going to be, and we can do training or you can do training yourself, and we'll make sure that the reporting to MOTS will continue. So that was a question that I popped. Any other questions that I might have missed that you think we should bring to the floor?
Looks like one more from Terry. How will this affect detox facilities? And I'm guessing that's referring to the eventual MOTS replacement.
That's an excellent question. I'm not familiar with the specifics of a detox facility. I know there were in the past separate options for getting that particular information, because they're kind of unique, because a lot of the detox places, it is a very short and intense time period, and a lot of things change from entering and leaving. And sometimes they're connected to a different treatment program, sometimes they're not. I'm not sure. I can't give a specific answer because I'm not really sure how, for example, the Oregon legislature wants information about detox organization, detox facilities. Those things change as well. There's legislatures every 2 years come together and they come up with new rules and new plans, and every couple of years we get to vote on certain things. And those things can affect us. There's budget changes that will affect us. There were some changes in the different programs. Sometimes federal programs change. I have no details about the detox at the moment, but as soon as we have all those details, and if we know where we're going and what the setup will be, we'll definitely let you know. And if you, like I said, not get the information, then contact us and we'll definitely get the information back to you. I hope that answered the questions a little bit. It's nice and vague, but sorry, that's all I can do at the moment. Anything else? That is a very silent crowd. Okay, well, that was a very nice webinar. Thank you very much for attending. Thank you for joining us, and hope everybody have a wonderful end of the year and a very merry holidays, and hopefully an amazing 2021 is in the waiting. So thank you very much again, and have a wonderful rest of your day.